Welcome to Health Unplugged, our superstars. Most of us don't even realize that dentistry is not just about fixing what is broken or visibly broken, but it's more about predicting what is going to come and how the outcome can be managed. Behind every smile, every implant, every aligner, and even a tooth implant, there is a lot of data, software, and increasing use of artificial intelligence. So today's conversation is not just about how machines are replacing the dentist, but it's more about how the AI is helping dental surgeon or dentist in terms of having their practice in a seamless manner and in terms of giving them better outcome with patients. Joining us today, we have Dr. Haritha, who is more than 8 years of experience in the dental industry, who is a FDS and orthodontist. Welcome to our podcast, ma'am.
Thank you.
Delighted to have you.
Thank you for having me here. So, I'm Dr. Haritha, an orthodontist and aligner specialist practicing in Vishnu Dental Clinic, Villivakam, Chennai.
Okay, welcome to the podcast, and let's get started, ma'am.
Sure.
Let's deep dive into how dentistry has been digitalized by using methods of AI. So, let's get started, ma'am.
Yes, sure.
My first question is how earlier the decisions were taken in terms of dental treatment.
First, earlier we used to do the treatment planning based on the visualizing the patient and doing the facial examination or everything. What we do, a lot of hard work is there behind the patient.
Right.
So now with the artificial intelligence or with the digital technology, that workload has been reduced for us.
Okay.
So I think this digital scanning and this artificial intelligence and all had made our work very easier by giving the exact treatment plan, like how the treatment will be going for the patient,
Okay.
or precise treatment planning for aligners and for even for a crown making, prepping, and all the technology has been helped us a lot. So it's a boom to dentistry, I feel.
Right. Okay. So, doctor, compared to the conventional method with the use of AI, how much dependability is there based on the current technology, or how do you implement it?
So with the current technology and with the AI technologies, like we are more easily connecting with the patients.
Okay.
So at the moment when they enter the clinic, we'll be having a digital scanning. So when the patient has been scanning their teeth in that, so at the front desk only, they will be come to know what kind of problem they have.
Correct.
So they would visualize before coming to us only. They could visualize what problems they have in them.
Mm-hmm.
So that is quite easier for us to explain the patient.
Okay.
So that I feel it is very good with the digital technologies.
Okay.
So and also after that, like taking the X-rays and all, before and all, we used to have a film for X-rays.
Right.
So it might take some time for to get the film. So but now we at that second only we can visualize the X-rays and we can explain the patient. So it has reduced our workload with
Okay.
the technologies. I think.
So, as we just heard, AI is helping the dentist or the doctors to reduce their workflow in terms of doing the preliminary treatment for the patient and coming up with the treatment plan. So, really, that is really great for that. So, let's move forward. So, were there any limitations in terms of the treatment plan compared to conventional method and with the use of AI now?
Yeah, I could tell, but like how like initially like there might be some limitation for us to do the treatment planning. We might have missed any caries, dental caries, and all when we are visually examining.
Okay.
But with the digital scanning or with the AI technology, we won't miss any dental caries or
Right.
any kind of swellings or anything. We can't miss with the technologies. I think. So with this, it can visualize more.
So the initial part of the dental treatment becomes easy with the use of AI. Let's deep dive more into the other aspects of using AI with doctors. So in terms of the treatment plan, what is the reduction rate in using the treatment plan compared to the conventional method, and how AI is supporting it to be foolproof?
Okay. Like before, we might because doctors used to do the treatment plan everything. In between, we might change some treatment plans,
Correct.
like based on the patient and how the treatment is going. Based on that, we
Right.
might change. But with this technology, initially only we will plan everything, like how the treatment will be going on for that patient and what are the steps will be there. So we won't miss anything in the treatment. So I think this technology has reduced that kind of problems in making a decision making.
Right.
So it has been.
Okay. So taking forward the same line of questions, what fundamentally changes when dentistry decisions are made with AI tools?
Okay. The fundamental change is that like there's not a major change. Like the change is that we will be everything digitally displaying it to the patient. So before we won't be doing that, we'll be explaining a lot to the patient. Now we are digitally showing the patient like how your treatment will be, and the end of the treatment, how your teeth will change. So
Right.
everything will be visually explaining the patient. So that I think that might be the changes, and the patient will be having more clarity about the treatment. So that I think will be the major changes in the.
Okay, so it's like the before and after
Yeah.
treatment is already explained to the patient beforehand, and the
Mhm.
patient can make consented decisions
Definitely.
in terms of any treatment that they take up.
Definitely. Like for example, if they're having a spacing between a teeth, or if their teeth has been protruded, we'll just show a simulation of the how the treatment will be there for them.
Okay.
Like before and after will be shown at the time of the consultation only. So they could have an idea like this is how our treatment will be ended after the treatment.
Mm-hmm.
So that way it is very
So
helpful.
that way the patient will be able to decide how the end result will look on the particular treatment, right?
Yes. Yes.
So it will be definitely useful for them also to take a decision.
Yeah.
So digital dentistry will help you to take decisions, but what is that one thing that it provides? Is it the clarity or the accuracy of the treatment? What is more impactful?
I think both, like
Okay,
both accuracy as well as the
clarity.
clarity also, both will guide us, because the accuracy when we talk about, like I had explained before, like when the moment when we are examining or scanning their teeth only, we'll be knowing what kind of caries or what are the other problems in them,
Right.
so we won't miss anything. So the accuracy will be there with us, and also the clarity in the treatment also will be there when we are doing all the kinds of like a simulation or digital scanning or digital X-rays, everything. So we'll get a clarity and accuracy with the digital treatment.
So it's like the digital X-ray will give you a full picture of the entire teeth structure of a
Definitely.
patient, and that helps you take decisions in terms of a specific patient treatment
Yeah.
plan, right?
For example, I can give you, for example, if there isn't any impacted teeth, like wisdom teeth will be impacted. So with the help of the CBCT or with the help of this three-dimensional imaging, we can exactly know where the tooth is and
Okay.
how the nerve is be near to that. Is like, will it be very difficult to remove the teeth for that particular patient? So
Okay.
everything we can tell it to the patient at that time only. We'll be knowing the results at that time.
Beforehand.
So it is very useful
Yeah,
for us.
right. How does the mentality of a patient make an impact here? Like you just mentioned that there is a digital scan that is done. So is it more convincing and more comfortable decision for the patient to make?
Yeah, definitely. Like now it has been 5D scans are also available.
Okay.
So we can examine or we can visualize the whole face, and we can examine the teeth structure, everything to the
Right.
patient. So we can explain to the patient like how your teeth will change. When your teeth are changing, how your face will change. So everything we can explain.
Right.
So they will have an idea like how our teeth face will changes after our teeth correction.
Mm-hmm.
So everything we can.
So it is going to be
just-
very impactful
yeah,
with the help of AI.
yeah.
Okay. Since we are talking about how AI is helping the patient, does digital dentistry will increase the upfront cost that is incurred to a patient? How does it impact the patient?
So talking about the cost for the treatment, I think if we spend a quality amount of cost for a particular
Right.
treatment, then our overall health will be improved. So as we know that oral health is very important for our general health. So I think we don't want to mind about spending on the treatment. So we want to only focus on our health. So the cost should be the second factor, I
Okay.
think.
So as doctor mentioned, the cost is an impactful factor, but the overall dental hygiene is more important. So ma'am, how important is the experience of a dentist while using these digital tools or while using AI for different kind of treatments?
This experience is very important. Even before this digital scannings and all, the experience of a dentist is very important to know the right amount of diagnosis and all. So after this digital technologies also, we should have a proper knowledge and experience in this digital technology, so that we can guide the patient and we could easily diagnose in a second.
Right.
So we should have a proper knowledge and experience with this digital dentistry.
Okay. So it's not just about Googling your treatment plan, it's also about the experience of a doctor and the knowledge that the doctor has. So get in touch with a certified experienced dentist on One Health Assist website, and you can book your consultations right away. Let's start talking about the different types of braces. So ma'am, can you please walk us through what are the different types of braces that are available?
Yeah, definitely. The braces, as we all know, there are metal braces are there, like ceramic braces. It's a white one, which is not much seen.
Okay.
And then self-ligating brackets are there. The self-ligating brackets is like it is little bit expansion will be there with that kind of brackets. So that was about the bracket section, and then aligners are there.
Okay.
So aligners we mostly know, like with the digital media
Right.
and social media influences, we know nowadays a transparent one, removable one, so we can remove it while we are eating.
Okay.
The different types of braces and
Yes.
aligners.
As you just mentioned that there are three types of braces, so can you give more information on which braces are more suitable for which type of patients or conditions?
Okay, like comparing the braces and aligners, the braces are very useful and they outperform in some cases when there is surgical kind of corrections are there,
Okay.
or there where we have to do lot amount of corrections. In that cases, braces works very well.
Okay.
So coming about talking about this metal braces and all, this metal braces is quite cheaper, and most of the patients they prefer to wear metal braces.
Okay.
So this metal braces is we can use it for all the type of cases. In that, if some patients they don't want aligners, if they want little bit transparent thing, then we can give a ceramic braces.
Okay.
That ceramic is little bit a whiter bracket. So if you give that to the patient, they might not feel that awkward like metallic thing. They won't feel that thing.
Okay.
So then self-ligating brackets we use in certain cases when we want a little bit of expansion in the upper arch and the lower arch.
Right.
So in that cases we prefer self-ligating brackets. So aligners we prefer the patient who wants, like they don't want any metallic smile or they don't want to show their metallic
braces.
brackets to others. So for that cases we prefer these aligners. And now the aligners are a trend in the dentistry.
Yes. Yes.
These
So
are
we-
different types.
So we just heard about the different types of braces and how they are mechanically different in a patient case scenario, and how different the aligners are, and why they are picking up so much of a boom in this current scenario. Let's elaborate a little bit more on the cost advantage part. So in three different types of braces, which is cheaper, which is more effective in terms of cost?
So talking about the cost point, the metal braces are a little bit cheaper when comparing to the ceramic brackets or the self-ligating brackets. So these self-ligating brackets are a little bit higher price when we compare to the metal brackets.
Okay.
And while we take to aligners, the aligners are comparatively they are more costlier than these brackets, isn't it?
Okay.
It is the cost-effective part.
Okay. Personal question. We just covered all the aspects of dentistry and how braces are different from aligners. Let's ask some personal questions, ma'am. How did you decide to study dentistry, and what inspired to become an orthodontist?
So talking about my personal thing, that I want.
Yeah, you can start.
Like talking about my personal thing, I chose dentistry just to give a happy smile in every patient.
Okay.
So I like to see that happy smile, and when patients they just encourage us and they just give a beautiful smile, and their rewards to us
Right.
is very important, I feel. So that is the point I just decided, okay, like from normal basic dentistry I just upgraded myself in orthodontist. So in orthodontist I like to give also straightened teeth, like all perfect smile. So that thing I feel like orthodontist by HS orthodontist.
So that's really inspiring for us to know that how a perfect smile can be generated with the help of a dentist, and how braces are going to align the teeth and give you a perfect smile. Can you share with our viewers one of the most complicated cases that you have handled, and a case that would have touched your heart?
Complicated cases, I feel like the cases which I had done before 3 years for a male patient whom the canine teeth is very impacted. That is, the canine teeth is inside the bone. So
Okay.
we had surgically opened that tooth and we had removed the tooth outside and we had given him a aesthetically pleasing smile. So that journey for me is very new and it was been very experimental for me. So I was very happy to give that patient a smile with a completed look with all the teeth.
Right.
So I feel that is a great experience for me in this journey.
Thank you for sharing such experiences with us, ma'am.
Thank you.
Let's cover some myths and facts with doctor. Ma'am, are the braces only for kids?
No, it's a myth. It's
Okay.
for both adults and kids.
My next question is, aligners don't work for serious cases. Is that true?
Not entirely true. Like we can't tell like that. Many cases it works.
Okay, so it's just a myth.
Yeah, it's a myth.
We all have heard that orthodontic treatments is very, very painful. Is that really true, ma'am?
No, it's a myth. It's not exactly like it entirely extremely painful. It might be painful for in a certain time, like
Yeah.
1 week, first week of the treatment, it might be painful. but it is manageable.
From childhood, we have heard that if there's a fear of going to a dentist and having a drill inside a mouth, so that's not fearing.
No, no, that is a myth.
Okay.
Now it is a painless dentistry.
Okay.
So that is it's a myth, I feel.
Okay. There is one more myth that I want to cover. Once the teeth are straightened, they remain aligned or straight forever.
No, it's a myth. You have
Okay.
to wear a retainer to make it in that position. So we have to. It's a myth.
Okay, it's purely a myth. We covered about how AI is helping the doctors to come up with a treatment plan and what are the different types of braces, aligners. My next question is, what is the future of dentistry? Where do you see dental industry in next few years or say a decade ahead?
Okay, the future of dentistry, when we're talking about, I think the future of dentistry is based on this digital technologies
Right.
only. So we'll be end up in doing the treatments plan, everything in a minutes within the patient entering inside, and they would know like what is the treatment plan and how it is going to be done and how much time it is going to be happen. So it's a technology driven field only. So everything will be covered with a technological aspect. So it's very
Yeah.
easy for us and for the patient to
So
painless dentistry
yeah.
will be there.
So do you think that it will be more transparent in terms of the treatment plan, but also in terms of the data security when you're maintaining the data of patients?
Yeah, I think the transparency will be there between the doctor and the patient regarding the treatment
Absolutely.
plan.
Yeah.
So this ethics maintenance, everything will be there. That will be depending on the doctor's
Yeah.
their treatment.
And that really helps a doctor to maintain a rapport with the patient and work for future aspects as well.
Yeah,
So as we are discussing about data security and transparency of patient data and maintaining a rapport with patient-doctor relationship, on One Health Assist platform, we have a very good feature which is called as a One Health Locker, a DigiLocker that will help a patient maintain all medical data files in a digital format. It will help track all the records. Plus, in case of emergencies, the data can be shared with doctors or the other practitioner as well. So the patients can use this facility on One Health Assist platform lifetime free of cost. Do you think that dental treatment will become more of a preventive treatment rather than how it is that when there is an issue, we come up and go to a doctor?
So talking about a preventive healthcare, like oral health care is very important to for our general health. So once our oral health is very good, like we can prevent a major health problems like heart attack, like diabetes, everything. For example, in case of diabetes, if we are talking, we can diagnose if they are having a diabetes or not, like
Right.
checking their periodontal health.
Right.
So for that condition, I think the oral health is very important. It prevents our general health. So it is always a preventive dentistry.
Okay. So you just heard, the viewers just heard that oral health is very important in terms of managing your lifestyle, in terms of doing your daily schedule in a right manner. You can use the features on One Health Assist platform where you can set reminders for pills, you can track your calories, you can get consultation with our dietitian as well. So please log on to One Health Assist and use all the features upmost. So to sum up here, I would definitely want to know how One Health Assist platform is helping you as a dentist and how your patients are getting impacted by using One Health Assist platform.
Yeah, definitely. On Health as a platform has been very helpful for me to get increase the walk-ins in my clinic,
Right.
and they also they know that they are very secured in this place and their data is not shared anywhere.
Absolutely.
So I think this platform is very helpful for the patient as well as for myself to maintain my records and everything.
Yeah.
So I think this is very helpful for me.
As the doctor just mentioned, One Health Assist platform, the data is all secure in a digital platform. We are HIPAA compliant and the product is patented. So all your patient data will definitely be secure on the platform. So log into One Health Assist and secure your data. This brings us to the end of this podcast. To book a consultation with a experienced dentist, to know more about braces, aligner, and customize your patient experience, you can book consultation with doctor on One Health Assist platform and get online consultations as well.
Thank you for having me in this podcast. I think we had enlightened more on about how the AI has been helping in this dentistry. I think it's very useful for you. Thank you.
This is your host Deena signing off for now from One Health Assist. Please stay tuned and please like, share, and subscribe our channel.